Hey everybody, it's Dr. Troy here. I'm here with Misty from the office from Zenaptic Chiropractic in Vancouver, Washington. And I want to talk about car accidents because we see a lot of car accidents. There's anywhere from 300 to 500 car accidents in Clark County every single month. So if you're unfortunate enough to be in a collision, whether it's your fault or not, we've got a little bit of advice we want to give you. And I want to ask Misty some of the common questions she'll hear on the phone and some of the common things that we tell people to do after they've been in a car accident. So Misty, if somebody gets in a car accident, what would you tell our audience to do?
I would say that the sooner you can get in for treatment, the better. Typically with an acute injury, you want to get seen the sooner the better, because then it allows for the joints and the muscles to be mobilized and your pain to decrease at a much faster rate, whereas if you wait 6 to 8 weeks, it could take a little bit longer.
How many people do you, when you answer the phone and you do consults with patients, how many people tell you the pain started 10 years ago from a car accident, whether they have neck pain or back pain? How many people tell you that?
Probably 85%.
85% of the people. So you would say it's very important, even if they didn't have symptoms from a recent car accident, to get in right away.
Yes, I would suggest, even if you were in a motor vehicle collision and you may not be experiencing symptoms right away, it's always good to come in for a consultation, because there could be things going on that you're just not feeling yet. Sometimes it takes a few days before the pain shows up, but we definitely would want to get you checked out sooner.
And I read something recently where patients who are in a car accident, they could have delayed symptoms up to 3, 4, 5, even 6 months after the accident. I've seen that where patients come in and they're like, we'll question them, like, when did this shoulder pain start? Well, I'm not really sure. And then you start questioning them and you find out they were in a recent car accident within the last 3 to 6 months. And they're like, that's when it started. So you'd be surprised how many hidden injuries are there, and I know you know this as well.
Yep, and it's not uncommon. We have had several patients who have come in after a few months after their collision, and they were experiencing symptoms. It just was a delayed response.
And what's the typical thing? A lot of people get in a car accident, they'll go to the hospital, and what type of things do the hospital tell them to do?
So a lot of the times when patients are involved in a motor vehicle collision, they will go to the hospital and they're prescribed medication and told to ice, and then they're sent home. Really, the medication is going to mask it. We are here to help correct it. We want to make sure that the injury isn't going to continue and become a problem for your life.
And what are some of the treatments we offer? I know there's chiropractic. What other things do we do in the office?
We also offer hydro massage therapy, spinal decompression, and rehab services as well.
And I know one of the things that you might not be familiar with yet is we've incorporated laser into our treatment protocols as well, which can help really speed up healing. So if you've been in a car accident recently, call our office, schedule a consultation. Be happy to take a look at you, verify your insurance, and most people don't need a referral to come see us. They can come straight to us, and many insurance companies will cover chiropractic care, massage care, rehab related to a motor vehicle accident. So call our office, 360-260-6903. Thanks, Misty.
You're welcome.